And mothers aren't the only ones feeling the impacts of the coronavirus. Doctors now say that they are seeing a new mental illness in survivors. A small number of COVID-19 patients are developing symptoms of psychosis, a condition where someone is unable to figure out what's real and what's not, which is frightening. It's happening weeks after contracting the virus. For more on this, let's bring in Dr. Jonathan Komisar, who is the co-chief resident of Combined Internal Medicine and Psychiatry at Duke University Hospital. Thanks for joining us.
Thank you for having me.
So we know that psychosis is an illness where people lose touch with reality, but what more can you tell us about the symptoms that you're seeing in patients?
Yeah, that's an excellent question. So psychosis is actually a constellation of symptoms. Most commonly, individuals think about hallucinations or what we would say delusions, meaning thinking that a false belief is real, or hallucinations, seeing or hearing things that might not be there. And they can sort of present all along the spectrum of the symptoms with patients. Particularly what we're seeing with COVID is a lot of patients presenting with predominantly delusional content, thoughts that their loved ones are out to get them, thoughts that they are infected with the virus when they might not be, thoughts that they're not safe at home or their children aren't safe at home. So that is a particular unique aspect of what we're seeing with COVID psychosis currently.
And are these symptoms that they will be seeing for a long term? For example, there's this phrase that I keep hearing during this pandemic, long haulers. Will that be the case with these patients? Is this something that they're going to have to live with for the rest of their lives?
Yeah, so that also is an excellent question. I think it actually speaks to the point that this isn't something new insofar as we've seen respiratory viruses in the past cause psychiatric symptoms. And in fact, in the 1918 flu pandemic, there was a significant amount of patients who developed either psychosis or psychiatric symptoms after the fact. Now, what is quite interesting about that and what is promising about the current situation is that patients during the pandemic in 1918 actually had a full recovery when sort of looked at 5 years after they had developed the onset of symptoms. So it's definitely too early to tell whether or not patients are going to continue to suffer from psychiatric symptoms secondary to COVID-19, or in this case, psychosis secondary to COVID-19. But the hope is that it's not a long-term symptom that they'll have to deal with, and it will resolve over time.
You know, we talked about how, there's still research being done as to whether this is going to be a long-term thing for people. Mm-hmm. But if they think they're in this situation, what are the symptoms that they can look out for? When should they go to a doctor and say, hey, I'm having these psychotic episodes?
Yeah, so that is also a fantastic question. I think there are two sort of ways I think about this with patients. One is in instances in which patients have awareness that they're starting to not act like themselves. So they're starting to notice that they're worrying more about things that maybe they wouldn't normally worry about, that people are listening in on them, that they're maybe hearing things that aren't there. And that's an individual who has some insight into what's going on. And I would encourage them in that circumstance to be better safe than sorry and reach out for help and for an evaluation. The other side of the coin is when a patient isn't aware that they're going through this experience. And in psychiatry, we call that having no insight into their illness. And in that circumstance, usually it's their loved ones or their significant others or friends or family who notice abnormal behavior. And in those instances, you might see things such as, patients not interacting with you, withdrawing from interactions with their friends or family, starting to act bizarrely, meaning doing things that they wouldn't normally do, struggling to do everyday tasks, and maybe look as though they're responding to voices or things in the room that aren't there. Those would be instances where I would say it makes sense to reach out for help and to go to a doctor, but I would set a very low bar to reach out for help and go to a doctor for an evaluation.
Something else that I thought was interesting is that there are the people seeing the effects of this are they typically younger?
Yeah, so I do think it's too early to tell that. We're only just starting to get more case reports, which are just single instances of patients with these problems, and then doctors publish them online for other doctors to review. And as the pandemic advances, and we have potentially more cases develop, we'll have a better understanding of what is the normal age that we are seeing this in. Are we seeing this in a specific age, in a specific gender? And if so, what's the time course of the illness? Now, it is interesting for us as psychiatrists to see the types of patients who are developing psychosis right now from these cases of COVID. And I say that with the caveat that, we don't have definitive evidence that COVID-19 is causing this, but in some of these cases, it is the most recent thing to happen to the patient. And so that's why we think there might be a relationship there between the infection and the patient being sick. We're seeing it in patients that don't have a psychiatric history, that have an acute onset of their symptoms, meaning that it happens right away, that are outside of the normal ages that we would expect for the onset of psychosis. So in many individuals, we expect the first episode of psychosis to occur between the ages of 17 or 18 to early to mid 30s. And in the New York Times article that recently came out that discussed this, we were seeing patients who were much older, who didn't fall into the normal sort of age range that we would expect illness onset. And so that's what's sort of been unique and also alarming for us as care providers to want to make sure that both patients and other care providers are aware that this could potentially be a complication of COVID-19, and to be diligent about looking into this if a patient comes into the office with these symptoms.
And some doctors are saying that much of this brain fog and memory problems in COVID-19 survivors, it's caused by something called persistent immune activation. What is that?
Yeah, so I don't purport to be a neuroimmunologist, so I'll do my best answering that. But the theory is that the body exhibits an immune response. So your immune system revs up in the setting of an infection, and there's almost like friendly fire. Basically, your own immune cells start reacting to your own body cells, and in this case, cells in your brain, or cells that affect cognitive function, or cells that affect your memory or thinking or how you perceive the world. And that can follow a gamut of symptoms. You can have symptoms like cognitive slowing, or what we're seeing with the brain fog. You can have symptoms of hearing or seeing things that might not be there, that we're seeing with psychosis. And so the concern is, and what we're still trying to figure out is this a direct effect of the virus? Is this the virus directly attacking the nerves of the brain? Or is this the body's response to being infected with the virus, and it's the body attacking parts of the brain? I don't think we have a clear answer of that yet. And there's certainly still a lot of work to be done on that. And hopefully we get a better understanding of that as we move through the pandemic. But most importantly, understanding that will allow us to treat patients in the most effective way for them to recover and for them to regain their level of functioning.
Well, this is really important information for our viewers. We appreciate your time and the research that you're doing. It's amazing how scientists, doctors all over this country are studying this pandemic in real time. It's really fascinating and unsettling in some ways, some of the symptoms that are popping up of this COVID-19. Dr. Jonathan Komisar, thank you for staying with us. Appreciate your time.
Thank you for having me.